My name is Ruth Casas, and I'd like to share our new digital preoperative screening and assessment tool developed at the Norfolk and Norwich University Hospital over the last 3 years. So to start with the context, after the pandemic, our trust was hitting the headlines with one of the longest elective surgical wait times. Elective recovery was driving an increase in theatre activity, but pre-assessment capacity, limited by staff shortages and physical footprint, did not meet the additional demand. On average, the pre-assessment team's first contact with patients was happening only a week before their surgical date. We tried different approaches to improve our oversight of the waiting list, but found that more than 80 physicians within the hospital could book pre-assessment appointments, and trying to work cohesively within such a complex system was failing. Patients could not safely be prepared or optimised for surgery at such late notice, and our late cancellation rates were high. We needed to change how we were working, and we needed oversight of the waiting list to take back control. Our vision was to create a sort of specialist pre-assessment waiting list. To do this, we developed a digital tool based on a patient questionnaire with 3 central functions. Firstly, depending on the answers the patient gave, the questionnaire triaged patients into 3 groups, red, amber and green, indicating what type of pre-assessment they needed, anaesthetist, nurse face-to-face or nurse telephone. Secondly, it would alert us to those things that we could optimise. These would include prehabilitation alerts, for example smoking cessation advice, abnormal blood results, specifically HbA1c and haemoglobin, and pharmacy alerts for those medications that need stopping ahead of surgery. Thirdly, the information within the questionnaire formed the backbone of the pre-assessment, saving preparation time for pre-assessment nurses and reducing variation between pre-assessments. A working group of doctors and nurses developed the digital tool, and we ran a series of coffee mornings for patients and carers, and with them co-produced the questionnaire. There were multiple stakeholder groups to involve, including all surgical specialties, operational and administrative teams, and of course our digital team, with whom we work closely. Once written, we trialled the questionnaire on 50 patients over the phone, identifying problems and making improvements. We further validated it on the longest waiting patients, and finally we've recently started to send the questionnaire to all patients at the time of booking. The full tool only went live in April this year, but more than 7,000 patients have already used the system, and our initial outcome measures are promising. In terms of patient outcomes, our high-risk patients are now seen early by an anaesthetist, allowing time for optimisation and shared decision-making. Our prehabilitation nurse can now deliver a variety of interventions, so patients are better prepared for surgery with reduced perioperative risk. In terms of staff, developing the tool has motivated us to arrange dedicated educational afternoons for our pre-assessment nurses and HCAs and improved the team's engagement in quality improvement. And finally, process outcomes. The completion rate of the questionnaire is 75 to 80%, and qualitative data shows 100% have found it easy or very easy to complete. We've started 30-minute telephone pre-assessments for green patients, increasing our preoperative assessment capacity, and we're identifying a pool of patients who are able to be prepared for surgery at short notice when required. Our new processes ensured we're aligned with the NHSE preoperative screening guidelines, and excitingly, we now have a robust system that we can continue to build on, empowering our team to further expand and improve. Thanks for listening.